Welcome to Healthy Living, your health awareness show on Afro Worldview, the show that keeps you informed with all your health-related matters. My name is Ronald Abaji, and today we shed light on World No Tobacco Day. But first, let's check out what we have for you on the show. We speak to Dr. McKay on the dangers of smoking. We then speak to Sian Maparoma from Santa and wrap up with a fitness routine. In South Africa, smoking is responsible for 121 deaths a day. But even if you don't smoke, secondhand smoke could kill you. Dr. McKay gives us insight on health risks related to smoking. Dr. McKay, thank you for your time and joining us on the show.
Thank you, Ron. Nice to be here.
We all know that when you go to a doctor, they ask you, do you smoke? And if you say yes, they say stop immediately. And if you say no, they say don't start. Why is that?
Yeah. In fact, I just had a patient earlier on and he said, are you going to bring up the smoking issue all the time? And I said, absolutely. And I'm going to fight with you whether you like it or not. It's such a critical thing. You know, smoking affects virtually every organ in your body. And so it's an essential part of a consultation. Do you smoke? And whenever patients complain about anything, and that's why they come to us, you can actually tie in, and there's a link between most symptoms and cigarette smoking. So if you want to be healthy, and if you want to have a life where there's not many complaints in terms of visiting a doctor, the first thing, it's absolutely imperative that you stop smoking. The list is endless. Medical conditions, surgical conditions where smoking is involved. So smoking forms an intricate part of a normal consultation and the questioning in the way we talk to our patients.
Why is smoking so addictive? Or is it just a habit or a combination of the two?
You know, it's interesting, if you break down what is in a cigarette, everyone thinks it's just a plain cigarette and it's, whether it's light, heavy, whatever the case is. We're looking at thousands and thousands of chemicals which are converted into what we call carcinogens, cancer-causing agents, toxic substances, the moment you light a cigarette. In addition to that, then there's the nicotine. And nicotine is a highly addictive substance. You know, patients will say, yeah, but it's only cigarettes, at least it's not drug A or drug B. No, it's highly addictive. And that's the problem. And so what happens with addiction, you need more and more of the same drug to get the same effect as before. And so this leads to tolerance. So you may have started off as a light smoker, social smoker, 1 or 2 cigarettes, and before you know it, with time, you need 10 a day, 20, 30, 40. I have patients who are smoking up to 60 a day. So we should never underestimate the power of the addictive capacity of what's in cigarettes today.
Many people think smoking just affects their throat and their lungs, but you mentioned it affects almost every organ in your body. When we look at it from a perspective of that addictive component, many people now go the route of vaping and those e-cigarettes. Is that the healthier alternative, or is there one that we could look at?
Yeah, so there's a lot of interesting data that's starting to come through. Initially, I think we all had the impression, well, at least it's not as addictive or maybe not as dangerous. It's more socially acceptable. You see people smoking in the cars, indoors, in restaurants. But I think the data is starting to show that while it's probably a good thing, at least they're off conventional cigarettes and switching down to vaping, there are still issues with it. There are still the issue of cardiovascular disease, right? Non-lung cancers, okay? And there's still the issue of addiction. Some of them still contain nicotine. So there's still a significant problem, and I don't think we should just use the excuse that it is a healthier alternative. If something is healthy, it must be much better. It must not have other issues. And I think we may be reducing the amount of people who are smoking cigarettes, but I don't think we are reducing the health burden of the complications of smoking.
I think that's so true. And coupled with that, we also look at the combustible cigarettes and the electronic cigarettes. Both of them have these clouds and plumes of smoke. So every time the person's exhaling, you know, we are surrounded by that. And I'm very sensitive with my nose, and it begins to irritate me in my nose. And you know, we've met many people that have said they've suffered from cancer, emphysema, you know, lung issues because of the secondary smoke around them. Is it that severe?
Absolutely. I'm seeing a lot of patients, wives, older ladies, older family members, no history of smoking, yet they're presenting with cancer-related symptoms and cancer diagnoses. So while it's not as dangerous as primary smoke, secondary smoking is absolutely just as important and becoming more relevant today. And I think when we talk allergies, we talk exactly as you mentioned, irritants. So it's not just grass and dust and cat, but exposure to secondhand cigarette smoke is a very, very important cause of nasal irritation and asthma triggering asthma attacks, triggering skin problems and all sorts of things. So patients who smoke, people who smoke, pose a serious danger even to those who don't smoke. And it stresses me out when I see parents smoking in a vehicle with the kids in there, you know, smoking in their homes, smoking wherever and in socially unacceptable places. So something needs to be done about that.
What are the alternatives that people have when it comes to quit smoking? There are programs available that we know of, you know, these 21-day programs, 2-month programs. Then there's medication, and of course then there's the gum and the patches.
Yeah. So according to the data and what we find in clinical experience, probably a combination of those things work. You know, so the patient's own willpower and motivation. We talk about the contemplation. So they go through pre-contemplation and then the contemplation, and hopefully that's when they walk in and say, "Doctor, I'm ready. I know what the dangers are. You've spoken to me enough. Help me now." There's contemplation. They're making a decision. With that, we counsel them about smoking cessation agents. And what I like is there's counseling available, but usually there's two drugs, main drugs on the market that are available. And if you couple that with nicotine replacement therapy, such as the gums or the patches, very, very good results. I think the trick here is for patients not to become overly confident. So, you know, with the drugs, you can stop smoking within a week, a few days, and that does not mean that you are cured of your addiction. You need to follow the 3-month, complete the course, and that's at least 3 months of the treatment before you can pronounce yourself as cured. So I think nicotine addiction needs respect. We need to treat it with the respect that it deserves and approach it properly. But bottom line is there is help available if you do want to stop smoking.
What's the barrier for so many people to not go the route of stopping, but rather to adhere to it and find reasons? No, I'm going to pick up weight if I stop smoking. No, it's just a habit. I'm a social smoker. Yeah. So I call those crutches. Yeah. What is, in your experience, would you advise those types of individuals on?
Yeah. The common one which you mentioned, but if I stop, I'm going to get fat. It says it's not the cessation that's going to make you fat, it's what you replace it with. And a lot of them go to sweet things, so they start on the sweets and stuff like that, and chocolates, which makes them fat. I say that's never a good enough reason not to stop. Think about the potential danger that you have, just in terms of smoking. Now, not every smoker will get lung cancer, but every lung cancer patient was a smoker. That's the bottom line. You know, so we need to educate our patients about risk versus benefit. If you keep on smoking, this is what you're up to. The benefit, even if you get fat, that's okay, as long as you're not exposed. And then, of course, the other benefits of, which overlaps to your patient, to your family members, to the workplace, your whole environment. And I mean, you kiss better, you sleep better, food tastes better. There's so many overwhelming benefits of stopping smoking that there should be no excuse not to do it.
What about the teenagers and the youngsters when it comes to that little machine thing and it's water and it's hubbly bubblies and hookah? What do they say? No, I'm filtering it because there's water. That is more dangerous than cigarette smoking.
That's it's absolutely true. And even besides the smoking, just think of the exposure. You're all using the same thing. It's all going to the same mouth. Okay, so there's already oral diseases that you're putting yourself at risk of. And then, you know, it's well known that smoking this thing for at least an hour is equivalent to smoking 100 cigarettes. Now, no one smokes 100 cigarettes at one sitting, but this is what's happening. All with this misunderstanding, but it's healthier, it's safer, it's more socially acceptable, and we're doing it as a group, and the parents can see it. And I think the worst for me is when I see parents joining in, sitting at the table and doing this. So there's lots of education that needs to go into the hookah pipe. Lots of data coming through now that, again, while it may not be as dangerous as a cigarette, there are still dangers associated. And so the bottom line is, stop doing it. Stop replacing one bad thing with another less evil. You know, they all cause tremendous health risks.
Doctor, thank you so much for your insight, sharing your knowledge, your passion for healthy living. And hopefully there are some viewers out there that have watched this insert and said to themselves, I'm no longer pre-contemplating, I'm contemplating, I need help to stop smoking.
Absolutely, and I hope that too. Thank you so much.
Thank you, Dr. McKay, for sharing that insight with us. It's now time for your health news.
In your health news, mosquito-killing drug offers possible new tool for malaria elimination. Multiple high doses of the drug, ivermectin, are well tolerated and able to kill mosquitoes feeding on humans for at least 28 days after treatment. The randomized trial was published in the Lancet Infectious Diseases. Up to now, the mosquito-killing effects of lower doses on their repurposed drug had been short-lived. Anti-smoking drug initially more effective in women. An effective prescription drug used to help people quit smoking initially helps women more than men, new research suggests. The study from Yale School of Medicine found that Chantix helped more women than men for the first year of treatment. After a year, however, the anti-smoking medication worked equally well for both men and women. South Africa's Child Support Grant, introduced in 1998 with the objective of improving the well-being of young children, was intended to reduce malnutrition. But surveys show that there has been no shift in child malnutrition rates since the 1990s. That's according to the Center of Social Protection Institute of Development Studies. The Food Security South Africa mentions that social grants are essential to finance food consumption and reduce hunger in poor households. Hope for visually impaired rural people. Many disabled people are still overlooked when they apply for employment, but a new project may change the situation in South Africa. The South African Libraries for the Blind project will afford visually impaired people an opportunity to be able to read books and access information online with ease through the installation of computers designed specifically for visually impaired people.
After the break, we chat to Sian Maparoma of Santa. Stay tuned.